Let's talk about long COVID and the pelvic floor. So, I am a pelvic floor physical therapist, which means I treat things like bladder issues, bowel issues, pelvic pain. So, now that we've been in this pandemic a long time now, and more people are getting COVID, I've seen more patients lately with, actually this year is the first time I saw people with long COVID symptoms. So some of them got COVID back in 2020 and just now are coming in for help. But a lot of people got COVID this year. The thing that freaks me out a little bit is a lot of my patients have been vaccinated and they still have long COVID. So the estimates are 30% of unvaccinated people, or before we had a vaccine, would have long COVID. And now it's about 10% of vaccinated people probably have long COVID. And physical therapy, this is a profession that was built on helping people recover from illness and injury. So we are the ones that are going to see long COVID, along with medical doctors. But pelvic floor symptoms, nobody talks about this. But here's what I've seen. The most common one is the chronic COVID cough. And for some of my patients, and it's more prevalent in moms, they have bladder leakage when they cough. And so having a chronic cough, they have chronic bladder leakage. And so the treatment for that, which we're taught as physical therapists, the treatment, if you're leaking when you cough, is to get rid of the cough, which is a problem with long COVID. So, sometimes doctors can prescribe you a cough suppressant, a cough medication, things like that can help, but it might just be time to get that cough to go away. But pelvic floor therapy can help. We can help strengthen your pelvic floor muscles. It's sometimes Kegels. It's also all the muscles surrounding the pelvis that will help support it. So that's probably the most common thing I see is bladder leakage with the chronic COVID cough. But some other things that I'm starting to see more frequently that are, nobody's talked about this that I've heard or read, is I've had people with pelvic pain, with rectal pain, with constipation, with diarrhea, with tailbone pain, all these things from a lot of digestive issues. So that is a known fact that there can be gastrointestinal digestive issues can be a symptom of COVID, and now a symptom of long COVID. So that one is, can be any of those extremes from constipation to diarrhea, pelvic pain, rectal pain, tailbone pain, all these muscles. So that's something we can definitely work on. The digestive issues might be something else. You might need to see a dietitian or a GI doctor. I'm not sure if there's anything that can help that. I'm not sure if there's anything medically that can help a lot of these things. That's the problem with long COVID is it's new and we don't know, and the symptoms are wide and varied. But definitely with any kind of pelvic pain, rectal pain, tailbone pain, those are often tight muscles, and that can be caused from GI symptoms, from chronic cough, from something else. But pelvic floor therapy can definitely help with that. And another symptom I've seen is bladder urgency. This one also seems awful. So a lot of my patients can control their urge. They're not leaking, but because of, something that happened in their body. This one's a little bit harder for me to know what to do. I mean, I know how to treat bladder urgency, but what is causing it from long COVID is a little bit more of a mystery. And so with a few patients I've seen with this, like the techniques we typically use aren't helping so much, which is frustrating. This is probably the most frustrating one I've seen. The chronic cough, once the chronic cough goes away, which might take months, then the bladder leakage goes away. That's the treatment. Those patients resolved after months, but it resolved. The pelvic pain patients, those resolve. The bladder urgency patients, those ones haven't resolved with the typical techniques that we teach in pelvic floor therapy, so that one's a little bit harder. But anyway, I just wanted to come on and talk about long COVID in the pelvic floor because nobody's talking about it. So I want to say, number one, I recognize you guys and gals, and it has to be frustrating. Long COVID has to be frustrating. But pelvic floor symptoms, when, people talk about long COVID as cough, fatigue, those are definitely two major things I see. And they talk a lot about heart problems and lung problems, but I haven't heard anyone talk about long COVID in the pelvic floor, but it exists. Find a pelvic floor therapist, schedule a virtual consult with me. We can go over symptoms, or find a pelvic floor therapist in your area. And I will link some of those in the comments of how to find some, but hang in there, friends. I hope you find relief.